Silent heart attacks can be tricky to detect. It's important to be aware of the warning signs of a silent heart attack, which can be difficult to identify. Though not all of these symptoms necessarily indicate a heart attack, they could be indicative of a serious problem. A heart attack is a very serious medical emergency that occurs when the blood flow to the heart is blocked, preventing the heart from receiving enough oxygen and nutrients. This can cause damage to the heart muscle, and if not treated promptly, can even lead to death. Here we are talking about the top 7 warning signs of a silent heart attack that you should not ignore. Number 1. Discomfort in the chest, arms, neck, jaw, or back. This is one of the most common signs of a heart attack, whether it's silent or not. It can feel like pressure, tightness, or pain, and it may be constant or come and go. This discomfort may also be felt in the arms, neck, jaw, or back. If you experience any of these symptoms, it's important to see a doctor immediately. Number 2. Shortness of breath. If you're experiencing shortness of breath, it could be a sign of a silent heart attack. Though you may not feel pain or other symptoms, this doesn't mean a silent heart attack isn't happening. Shortness of breath can be caused by a blockage in your heart's arteries, which prevents blood from flowing properly and can cause your heart to work harder than normal. It can also be a symptom of heart failure, which can cause a buildup of fluid in your lungs. If you're experiencing shortness of breath, it's important to see a doctor as soon as possible. Number 3. Nausea or vomiting. Nausea and vomiting are 2 of the most common warning signs of a silent heart attack. While many people may experience these symptoms during a heart attack, they may not realize it. Nausea and vomiting can be caused by a variety of things, but they are most often caused by the increase in heart rate and blood pressure. When these things happen, the blood vessels in the body constrict and the blood flow to the stomach is reduced. This can cause the person to feel nauseous and vomit. Nausea and vomiting are also common symptoms of anxiety and stress. If you are experiencing these symptoms, it is important to seek medical help immediately. Number 4. Sweating. Excessive sweating can be a symptom of a silent heart attack. While it is not always indicative of a heart attack, it can be a sign that something is wrong. Other warning signs of a silent heart attack include shortness of breath, nausea, and chest pain. If you experience any of these symptoms, you should contact your doctor immediately. Number 5. Lightheadedness or dizziness. If you experience lightheadedness or dizziness, it could be a sign of a silent heart attack. This is because when the heart isn't pumping properly, less blood is getting to the brain and other organs. This can lead to a feeling of being lightheaded or dizzy. If you experience these symptoms, it's important to see a doctor right away to rule out a heart attack. Number 6. Fatigue. One of the most common warning signs of a silent heart attack is fatigue. You may feel exhausted for no apparent reason, or you may feel like you can't get through your usual routine. This can be a sign that your heart isn't getting enough oxygen. If you're normally active and you start to feel exhausted all the time, it's important to see a doctor. Even if you're not having any other symptoms, fatigue can be a sign that something is wrong with your heart. If you have fatigue along with other symptoms, such as chest pain, number 7, abdominal pain or discomfort. Did you know that abdominal pain or discomfort can actually be a sign of a silent heart attack? It's important to take any abdominal pain or discomfort seriously and see a doctor right away, especially if it's new and you don't have any other symptoms. Abdominal pain or discomfort can be caused by various factors, including inflammation of the heart muscle, myocarditis, blocked arteries that supply blood to the heart, coronary artery disease, or faulty electrical activity in the heart, arrhythmias. These conditions can lead to a heart attack, and early diagnosis and treatment are crucial to preventing serious complications. Knowing the warning signs of a silent heart attack is critical for early detection and treatment. Chest pain or discomfort is the most common warning sign, but other symptoms include discomfort in other areas of the upper body, shortness of breath, irregular heartbeat, sweating, nausea or vomiting, lightheadedness or dizziness, and feeling unusually tired or weak. If you experience any of these warning signs, it is crucial to call 911 or your local emergency number immediately. Every minute counts when it comes to a heart attack, and early intervention can save your life.